usually get it up on my phone as well so I can see. Right, I think we are live. Not where we promised. Sorry, guys. Unfortunately, technological issues have meant that I've had to stream into the page rather than the group. Yeah, there we are. We are live. Oh, there you go. We're live. That's
Technology greatest.
Subtitles as well. Look at that. Okay, so yeah, not on the platform I was hoping to do, but it's fine. We're here. Everybody from the group. It's better this way around because everyone from the group can jump into the page. But if it had been the other way around, they wouldn't have been able to. So for those of you who have been expecting an exciting live today, I'm going to introduce Claire to you shortly. And we are going to be talking about a very exciting new treatment that I trained in literally the week before we went into lockdown. We were already doing the not shaking hands thing and lots of hand washing at that point. So I knew we wouldn't have long. And as a result, I've not had a chance to do one of these treatments yet. I've had one, it's amazing. But we are kind of in the process now. We know hopefully in the next few weeks, we're going to be able to start seeing clients again. And that means that we're going to be able to launch this, which is very exciting. So I thought now would be a good time to start telling you what it is. And Claire has very, very kindly agreed to come and join us for this live because she knows awful lot more about it than I do. So I'm going to let her take over. Claire, over to you.
Oh, thank you, Sally. Thank you for having me in the group as well. It's really nice to come and speak to so many people about the work that I do. So my name's Claire. I'm the CEO and founder of Wow Facial, which is a facial treatment that I started developing about 3.5, 4 years ago. It's been through rigorous testing. And then at the end, in the middle of 2018, I came across a little device that was perfect for me to slot into the facial, but then also perfect for me to extract out of the facial and sell as a standalone treatment because the results were so fantastic. And that little device is called the Wow Fusion, which is what Sally trained in.
Well, I've got quite a few
lockdown. So I've worked really, really hard with the facial to develop a protocol that you hyper-personalize so that you hyper-personalize it to your client's skincare needs, whether it's pigmentation, rosacea, acne, oiliness, open pores, aging, fine lines and wrinkles, whatever your skin condition is, there is something that we could do within the facial to treat that. And then when the Wow Fusion device came along, we were able to hyper-personalize the facial even further because I'm actually going to open this little one up. I shall probably use it on myself later.
I'm trying to work out how to do this on myself because I've got no one to do it for me. It's like there must be a way of doing this yourself.
You can do it over Zoom, but you're not supposed to. Obviously, it's a professional only treatment. So, but I have lots of experience of this. So this is the little device, and in here we make a personalized skin solution that is suitable for your skin. So this tiny little vial that opens up. And then it has, in the top of the device, we have, I'm trying to work it out into the camera, 20 really, really tiny needles. I don't even know if you can see. Oh, you can just out
so the end. Maybe it'll be easier to see if you tilt it so it faces us. So that, yeah. Can you see in there? Yeah,
really
anyway.
I've got a really good picture on a presentation. And what these needles do is they just break the surface of the skin, and then we deposit really high quality, sterile solutions into the skin that are designed to improve skin health.
I have been using the actual meso products for a while with my current needling system. So I'm already sort of familiar with those and how good they are.
Yeah. So we've got 5 in the range. So we always use hyaluronic acid as a base. Now, hyaluronic acid is what gives the body hydration, and it's throughout the body. It's a naturally occurring acid that we have throughout the body. So it's in our joints, our eyes, our mouth, our skin, all our tissues. And it is really, really good for attracting water to the area. So if somebody has a dehydrated skin, when you put hyaluronic acid in, it plumps out lovely, attracts lots of water and makes it all glowy and dewy. And then we have a multivitamin complex, which is lots and lots of B vitamins, so vitamin B1, 2, 3, 5, 6, 9 and 12. So all your essential B vitamins, which are vital for skin health, as well as lots of trace minerals and amino acids that help the body stimulate collagen and elastin. So really kind of working to revitalize the skin. That's what the multivitamins does. Then we have an anti-aging complex, which is mainly vitamin C, but your collagen precursors, so amino acids that help the body stimulate collagen and elastin. So as we age, and we start to age at about age 27, is when we start that slowing down in the production of collagen in the skin.
Isn't it? Because I'm quite a long way past that.
Yeah, me too. A good few years. So yeah, you know, anything 27 is actually a really, really good time for you to start considering skincare or gentle treatments. I don't recommend that you come and have some of the more aggressive treatments in aesthetics, but gentle treatments. Really start considering looking after your skin and preserving the collagen and elastin that you have in your skin.
As well, because that's if you can in your mid-20s commit to a really good skincare routine, that will pay back later in you know, huge droves, won't it?
Yeah, absolutely. And vitamin C is a really, really fantastic product for preserving aging and collagen and elastin. So our anti-aging has collagen, has vitamin C in it, which stimulates collagen and elastin. But actually, if you can use just like a really good hyaluronic acid serum with a vitamin C in it, and I know that you've got some fantastic products to do that in clinic as well, haven't you, Sally? That can really help preserve your natural collagen and elastin. It's a really powerful antioxidant as well. So that's kind of protects the skin from free radical damage from the sun and from pollution and smoking and drinking and all these other things that we get free radical damage from. Anyway, then we have a hair solution. So what this hair solution does, it helps prevent the hair from getting to the falling out stage quicker. So it kind of extends the growth phase of the hair so that your hair will grow longer and shortens the shedding phase of the hair. So you kind of end up with a thicker, healthier, longer hair as well. But it's also great if somebody is having serious thinning issues. And, you know, a lot of menopausal women get very thin around the front of their hair because of the drop in estrogen in the body. So we can really kind of work to stimulate the hair growth as well.
Can I ask a question on that, Claire? While I've got you on that bit, I have got a ridiculous amount of hair. I do not need hair thickening at all. However, because I have worn my hair up forever since I was 18 and joined the military and had to have my hair up, and I've just got into the habit, it always goes up. I'm thinning here. You can see it's pulled back. Would it help for that?
Yes, absolutely. It's fantastic for this hairline, and most women thin there. Me too. Look, I wear my hair up a lot, so yeah. It's really
that the edge, particularly this side, and I don't know why particularly that side is going back here, and I don't. It bothers me.
Most people lose their hair a little asymmetrical, particularly women as well. I don't know why, but yeah, maybe you could do an experiment and just.
Do a trial.
A little bit on one side. But
from people out the same way, we could add the hair bit in from a hairline, couldn't we? I guess.
Yeah, absolutely. So do your face first, and then do your hairline afterwards as well in the same device. That would work very, very well. So, and then we have after the hair, we have a whitening solution, which is for pigmentation, hyperpigmentation, sun damage.
I'm excited about this one because pigmentation is such a nightmare, and it's so difficult. It can be so difficult to treat.
It is really difficult to treat, and it is one of those things that requires a long course of treatment. So one treatment to treat pigmentation, you might see a more luminous look to the skin and a brighter skin condition, but actually in terms of reducing that pigmentation, it needs to take a good few treatments to start working to get that melanin, that darkened melanin, out of the skin. What we're trying to do is work it out of the skin and suppress the melanocytes, so the skin cells that produce pigment. What we need to do is suppress them so that they don't produce as much pigment as they were before. So it's a very difficult process managing pigmentation, but it's highly important if you do it. Yeah.
It's when you commit to treating pigment, you have to stick with it. There's no point going, well, I'll do it for 6 months and then stop using the serums and all that kind of thing, because it'll just come back again.
It's an ongoing battle. And actually, you know what? If your clients are not going to agree to wear SPF, every single day while they're having their pigmentation treatment, there's absolutely no point you doing it. The SPF is the most important skin.
Absolutely, and that's the point of most of my clients. If they don't want to use a decent sunscreen every single day, I don't want to start treating them, because they're not going to be happy with their results, because they're not going to be in the point where they can sort of move on and prevent further damage. It's so important. And
sun protection technology has come on so much, particularly if you come out to an aesthetic clinic or a specialist skincare clinic. They're not like the SPFs that you buy off the counter in Boots. They have, far fewer chemicals, more physical blocks, less nasty ingredients, more skincare ingredients, plants, stem cell extracts, and things that rebuild that skin barrier function and protect the skin, as well as hydrating and moisturizing it. So the advancements in SPF over the last 4 or 5 years have really, really come on. So
and that's why I use the product range that I do, is because their sunscreen's so good. It's got doesn't have chemical filters at all. And anybody who knows me will know I bang on about this all the time. I've done lots and lots of lives just on our sunscreens because they're so important. I've got some I'm conscious there are some comments and questions popping up on the right, so we'll address those. So, and if anybody does want to ask questions, please do drop them in on the questions, and I will make sure we address those as we go along. Do you want me to say, can you see them as well, Claire? I don't know if you can see them.
No, I can't see them because I'm not. I can't go on the Facebook page. Let me have a little look.
Yeah, so you'll be able to see the questions then as well. We've had a compliment. Alison said both of our skins look amazing, which is rather nice. No makeup. This is just our sunscreen. Having talked about sunscreen,
I've got SPF on as well. A little bit of blush and some eye cream that I wear.
My mascara on this morning. This is literally me out of the shower with my sunscreen on. That's it.
My SPF does have a little bit of colour in, which I think is, if you don't need a good coverage, I think an SPF with a little bit of colour in it is always is just, much better.
That's all I use now. I tried using foundation a while ago and it looked awful. I had to take it off. I'm so used to the finish that this gives now. It's so nice.
Yeah. All right, let's get into the group. Your group is called Xodos, isn't it?
So it's actually the main page, which is Xodos Aesthetics, rather than the actual group, because my techie brain failed me this morning and I couldn't do it. But we are here.
There we are.
So it's Alison there.
So just, I don't want to create. Oh yeah, there we are. We've got some nice one. Thank you.
What I need is the lash perm, because mine are quite short but very straight, so it looks like I don't have any. So a beauty therapist friend of mine said I need the lash kind of perm, which makes them look like you've got a bit more. So
I've had that done as well, and I do like it. I've got particularly long lashes though, so I have to be careful.
Short. They are dark, but they're very short, and they are straight, she said, so you don't see them.
Yeah.
So, I wasn't blessed. I've got all my hairs on my flipping scalp.
I always say that my hair always grows. All my hair grows out of my head because I've got a good head of hair as well. But so Alison said she missed what the hair product is. So the hair product is a combination of vitamins and minerals that are essential for hair growth, and also some things that some ingredients. So one mainly pyroxidine, which actually reduces the shedding phase of your hair growth cycle and lengthens out the phase of the hair growth cycle, because your hair goes through different phases. So we have a growth cycle and a shedding cycle, and what this does, it kind of, when people are losing their hair and their hair is getting thin, what happens is that the shedding cycle extends out and the growth cycle reduces down. So actually, if you can create a bit more balance between those two and lengthen out the growth cycle and shorten the shedding cycle, you will get a thicker, fuller head of hair as well. So that's how that works. So if somebody's hair is going back from chemotherapy and cancer, ideally you do need to leave it to grow. A lot of people's hair grows back very, very well after cancer treatments. But yes, if they need a little bit of help and support and they're cancer free and it's okay with their doctor for you to have this kind of treatment, then there's no reason why you shouldn't go ahead and
be careful. I always look at health and some medical sort of things. We've got sort of quite robust medical questionnaires. In fact, I actually have a copy of your consent form one here, and I know that includes some of the health questions, doesn't it? But yeah, so you are okay to treat people who have had cancer with WOW, all assuming my covers it, I guess.
Yeah, you know, as long as if they have not been given the all clear, so it's, you know, sometimes a very long time. It takes you 5 years sometimes to get the all clear from cancer after having lots of your tests and everything. If you've not been given the all clear, you will need to get permission from your doctor, just for the safety and peace of mind for everybody involved. But it's not a definite no. And I think, you know, that's it's, you know, one of these things. It's not necessarily a grey area. It just probably needs more intervention from other people as well, just to get the go ahead to do it. But it's definitely not a no, but it will need some sign off from your medical practitioners. Definitely.
Okay, fabulous. Okay, so where did we get to before I interrupted you with questions? So you were talking about the hair one.
I was just going to go and maybe share the screen. I've got a small presentation so people can get a little bit better ideas, some before and after pictures as well, which I thought people always like to see. So
Kate said, sorry, I'm late. That's okay. You've just turned up at exactly the right time, Kate, because Claire's about to share her screen and do a little presentation on it for us. So we were doing some preliminaries and talking about the product. But if Claire shares her screen, I hopefully, fingers crossed for the tech. I've had some issues today, so hopefully that's it for me. So have you done it?
Yes, can you see that?
Not this time. I did last time.
There we are.
There it is. Right, add to stream. Here we go. Yay.
Ta-da. Oh, it works. Fantastic. So so there's a little bit I touched on this as well, but the reason why I started to develop facial and then bring in WOW Fusion is that I spotted this gap in the skin health market, which was to offer branded hyper-personalized skincare solutions that are delivered under strict protocols, but help the practitioners who are delivering them deliver the best possible skincare for their clients. And it used to be a few years ago in aesthetics. I've been in aesthetics now for nearly 13 years. Everybody just did the same thing for everybody, regardless of what their skin condition was. Maybe a little bit of exceptions started to come in if people had acne or pigmentation, but even people with normal skin still have different skincare needs. So I just wanted to push those boundaries a little bit further and offer something that was hyper-personalized, but all under one brand, and, you know, with fantastic training just to make sure that the end consumer gets the best treatment for their skin. So that's why I started developing the facial. And then, like I said, back in 2018, I found the little WOW Fusion device. And I guess for my business, the rest has been history, because it's been one of the most satisfying products that I have ever sold. And I've sold a lot of products across a few industries, but I have to say the WOW Fusion device is just my favorite. I absolutely love it. So what is the WOW Fusion? It's a small delivery system that we put personalized solutions in. So whilst the device itself is quite novel, it's unique, it's fun to use, it's very quick, it's relatively pain-free in terms of a delivery system. The reason why we get such fantastic results and we can treat as many things as we can with the device is purely down to the ingredients that we put in the device. So you know, whilst the device is fun and looks nice and is easy to use, it is all about the solutions that we pop into the device that we went through earlier. And some of the things that we can treat are things like rosacea, excessive facial sweating, fine lines and wrinkles, enlarged pores, oily skin, sun damage and pigmentation, acne scarring, stretch marks. We can do hair restoration, which we've touched on quite a lot today as well, dehydrated skin, and just this general skin rejuvenation and revitalization that we could all do with a little bit of. So the WOW Fusion device is a fantastic one-off treatment before you have a red carpet event or a birthday party or a school reunion or, you know, wedding, whatever it is. It's a really, really good pre-event treatment, because it does give you just the most amazing, beautiful glow and shimmer to the skin that I've not seen from many other treatments in the industry after all these times. So this is a big picture of the device, but as you can see, it has got these very, very tiny needles in the top. So the needles are actually as fine as a human hair. which means that the delivery of the solutions into the skin is as pain-free as possible. It's not 100% pain-free, and everybody's pain threshold is completely different. You'll probably know this, Sally, from treating.
Yeah.
People can't stand them, and other people
I didn't find it too bad. I didn't find this too bad. A couple of areas you just, I think, what was it? She said, was it Pam? Was it Pam? I've completely forgotten her name.
Pam, who just training, yes, Pam.
Yeah, and she basically said, just got to put your big girl pants on for a couple of bits, and most of it was completely fine. A little bit sort of across the eyebrow, was it? You're aware of it, and a little bit across sort of the top lip, but otherwise, yeah, more than bearable, not painful.
Yes, absolutely. And you know, if you do have a low pain threshold, a little bit of numbing creams in sometimes in the areas that are more painful is perfectly acceptable as well. But most people don't need it. So that's you know, that's when I first was trialing the device. It was virtually pain free for me. So it wasn't until we went out and started training people and other people were using it that I realised that some people have different pain thresholds to myself. So yes, but some of the ingredients that we use. So hyaluronic acid, naturally occurring acid that is responsible for hydration and the attraction of water in the skin and the whole of the body, actually. So very, very important acid that we use in aesthetic medicine. So vitamin C, great antioxidant, all your B vitamins essential for skin health. Then your amino acids and your peptides, so these you know, partial proteins that help stimulate collagen and elastin. Then minerals for that revitalization, other anti-aging solutions that you can put in it as well that are available quite commonly in aesthetic medicine. And then glutathione, which is one of the most powerful antioxidants that we have in our armory as a business. So onto some before and after pictures. So this is a treatment for rosacea with just the hyaluronic acid and the multivitamins. So this is one treatment. So she looks fantastic. Now this is me. Actually, this is my rosacea. I have I did have, my skin doesn't look like, I don't recognise that as my skin now, but this was 18 months ago. Rosacea, open pores, oiliness, and bumpiness to the skin as well, that just after one treatment looked completely different. And my skin is entirely different to how it was back then. But I do have my toolkit that I can, work on to keep my skin looking healthy and glowing. So this lady suffers with something called rosacea. So not a lot of people know what rosacea is, but it's characterized by this redness and flushing of the skin, sometimes a little bit of crustiness and dryness, sometimes pustules, and it's often misdiagnosed as acne or adult acne, when in fact it is rosacea. And acne and rosacea need treating differently. And so it's really, really important for you to see a healthcare professional or your skin specialist to get a correct diagnosis for your skin condition so that it can be treated effectively. So this is just rosacea after one treatment as well.
Yeah, that's great.
Now this is using a very common anti-wrinkle injection treatment, which we're not really supposed to mention the name of, but this is keratosis pilaris, so chicken skin. So where the muscle around the pore on the body becomes hypertrophic and stands up, and you get this kind of bumpy, rough texture to the skin. So this again is just after one treatment. So just a much better skin conditioner, flattening of the keratosis pilaris as well, and just a much more refined look to the skin. So this is open pores and kind of discoloration in the skin. So just a much better texture to the skin, reduced fine lines, reduced pigmentation, and the pores just look a little bit cleaner. So I think this is a fantastic result. This is hand rejuvenation. Gosh, everybody's going to need this, aren't they? After we've everybody will probably still continue to wash their hands as much as they were before and kind of become obsessed with it. My hands have settled down now. They were terrible for the first few weeks, and they've really started to settle down now. So they're not as bad as what they were. But I think this back of the hand rejuvenation and up the fingers as well is probably going to be very, very popular.
Yeah, mine have definitely settled down as well now you mention it, but they're still not, there's still feelings a bit old and dry and wrinkly.
Yeah. So, you know, getting some hyaluronic acid and some multivitamins into the back of the hands, really to just rebuild that skin barrier function, work on that integrity of the skin, get the hydration and the comfort back into the hands, I think is going to be really popular post-pandemic. So guys as well, we treat a lot of men with this product, I think, because it doesn't come across as too girly. You know, sometimes when you think about facials, you know, men, do they go and have facials? They do, but you know, it's not, obviously it's much more of a woman's world, isn't it, the facial market? But we have a lot of men that come and have the Wow Fusion treatment done as well.
My husband keeps saying, so when are you doing mine then? And I was like, well, okay, I might do it as a live after this. I wanted to do this first, and then I will do his treatment as a live over the next few days.
Yeah, have a little practice on him first.
Yeah, probably a good idea. I haven't done it since training yet.
It's like riding a bike, Sally. You definitely won't have forgotten, as long as you can remember the little troubleshooting things that you learn on your training to make sure that the treatment goes without a hitch. You'll be absolutely fine. So I love this picture because the skin condition is so different. And I know there's a slight difference in the lighting, but you can just see how much her skin has improved from one treatment. So that's it. Just a small presentation, not too long. Don't want to.
No, it's great because people then can see a bit more about it, and obviously you're the expert as far as this goes. You know, I'll get there, but I haven't. You know, I'm literally just launching this. I've had one myself. I know how fabulous it was. You know, my skin felt amazing after that, and I've been itching to get on and do it. So I'm hoping that this will help people sort of come and see it and see what it is that it can do. So, but like I said, I have already been using some of the products, so I know what they're like. But I think because there's no downtime, you're a bit red for a couple of hours afterwards. But with my other needling, which is still great, and for things like deeper scarring and stuff, I love it. But actually, this will probably replace quite a lot of that. And I think I will be using this in a similar way. You know, because like I said, it's so bespoke. You can kind of mix it up with the peels and things as well, depending on what people need at the time. So I'm very excited to get started. I really can't wait to get started on this. And as we said, it can be used with that product that we must not mention or advertise, but not for, it isn't for muscle relaxing, it's for skin rejuvenation. There's a big difference, isn't there, in how it's used. Are you able to tell me a little bit about that without using the word we're not allowed to use? I've looked.
I think this particular medical product has been used in anti-aging for a long time to knock out muscle activity, which reduces the appearance of your fine lines and wrinkles. Your dynamic line stops you from moving your forehead, and it works pretty much the same way if you inject it into the skin using the Wow Fusion device. So when you inject it into the muscle, what happens is it prevents the release of something called acetylcholine from the end of your nerve, which is your signal to your muscles to contract. So actually, if that signal's just been turned off, they just sit there and everything softens out and sits there waiting for the signal. And then actually, as it wears off, the signal comes back and your movement comes back. So how it works in the face is when we block out this release of acetylcholine from the end of the nerve, that works on the smooth muscle around the pores. So the erector pili muscle. And what that does, that just creates a softening in the surface of the skin. And it also causes vasoconstriction, so it gets rid of redness. And actually, acetylcholine is also responsible in some way for inflammation in the skin. So if we block the release of acetylcholine, what happens is we turn off a lot of inflammatory markers in the skin as well, which reduces redness, reduces inflammation from acne and rosacea. We get a tightening of the pores because the muscle around the pore is softened down as well. And it just gives you a beautiful, like, glass finish to the skin and a much more even skin tone. So if you do suffer with redness, if you suffer with acne, oiliness, open pores, or any excessive facial sweating, this can be really, really fantastic to use just to add this beautiful glass softened finish to the skin. It's kind of like it's the polish for the skin. That's what I like to call it.
So obviously you wouldn't be using the product that must not be named in all of the treatments. So can you give us a bit of a rundown on how many treatments you'd recommend, how often we should be doing this? And also I know we put that ingredient in the first one if we're going to use it, don't we? So if you give us a bit of a routine kind of example.
So we could do the Wow Fusion Plus special ingredient as your first treatment. So, you know, particularly if you suffer with, like I said, rosacea, acne, open pores or oiliness, that's really fantastic. And any inflammation in the skin, because it will completely calm the skin down. And then a couple of weeks after that, what we can do is we can reassess the skin and we can see what needs to happen in terms of rebuilding skin barrier function or working on finer lines and wrinkles. And then you could choose your second treatment to treat what's presenting. So say the second treatment comes along that actually is more apparent that there's more pigmentation and sun damage than there was when you first treated. You could make up a bespoke cocktail of the hyaluronic acid and the whitening solution to treat the pigmentation. If it's more apparent that you've got more fine lines and wrinkles and a more dehydrated skin, then you could do, you know, your special treatment first, and then 2 weeks later do a hyaluronic acid with anti-aging complex. If your skin just looks a little tired and a little dull and looks like it needs some nutrition and some revitalization, then you could do the hyaluronic acid and the multivitamin. But usually as a course of treatment, what we would recommend is you do your first Wow Fusion with the special ingredient if it's needed for your skin type. And then we do another 2 treatments 2 weeks apart, treating exactly what the issue is. So fine lines and wrinkles, redness, pigmentation, dull, tired skin, whatever it is, and we just, you know, we will make up a cocktail that is suitable for your skin in those
first 2 weeks apart. And then what would you recommend for maintenance? So
for maintenance, so you could do the big one with the special ingredient in. You only need to do that minimum every 3 months. So every 3 to 4 months you could do that. And then a lot of people do just add in a single treatment as part of their monthly skincare regime. So a lot of people will do once a month. It's all down to budget, but once a month, once every 6 weeks for maintenance is good. And then once every three to 4 months with the special ingredient to keep that kind of glass skin and that inflammation down in the skin. So that would be a really good maintenance regime.
Okay. I'm just trying to think if there's anything else. I've got no other questions, I think. But I'm trying to think of what else other people might want to know. Obviously, things like pricing stuff is down to me, and I'll cover that because I haven't got any sort of paperwork on this at the minute to send out to people. I have got your fabulous marketing branded stuff here as well. Great, so I'll let people have some of those. Oh, and the other thing that obviously you did send us across. Do you want to tell us a little bit about this?
Oh, the Wow Mask, of course. Yeah, so the Wow Mask was actually the inspiration for the whole of the Wow facial. So the Wow Mask was a product that I had anyway, and I wanted to design a facial around the mesotherapy element of the facial, which was, you know, for skin rejuvenation, but the name came from the Wow Mask, and it is a supercharged hyaluronic acid, hydrolyzed collagen, stem cell and peptide facial mask. Now it has very special technology, and so there's a lot of these sheet masks around at the moment, and that, you know, people often ask me why the Wow Mask is so such a premium product, and it's because it has special delivery technology in it as well. So it's a double-sided mask, so there's technology on the outside that differs to the technology on the inside. So you really need to make sure that you put the mask on the right way around. So on the outside, it has this transdermal delivery matrix that kind of tightens up over the skin. And then on the inside is a gel that gets activated by the heat of the skin. And both of those together add an element of pressure and change the surface tension of the skin and allow for the ingredients to be absorbed deeper into the skin. And in there are ingredients that calm and soothe the skin, plump out fine lines and wrinkles, protect the skin from free radical damage, and just really add this deep hydration to the skin that can last for up to a week. So as a standalone product, it's fantastic, but as a product, it was designed originally as a post-treatment mask. So, and it was designed to be used post-microneedling because it's a clean-packed product with all these fantastic ingredients that just help soothe and calm the skin down instantly. So I love it. We're
using one of these after the Wow treatment.
You can use them after the Wow Fusion treatment, or, you know, a lot of people use them at home before they have an event, because your makeup goes on brilliantly after you've had one of these masks on. It's super hydrated, super plump, and a much more even skin tone and complexion. So yeah, it's suitable to be used like in the clinic after needling, and then at home as a standalone treatment as well.
Okay, I will talk to you more about that, because I've had one in my grips for a little while, but I've not done it, and I need to talk to you a little bit more about that, because I don't have any sort of to use in the clinic. So I will talk to you about that.
Well, treat yourself to that one, Sally. That's what I say.
Right,
but make sure you put it on the right way. So I'll send you some instructions. So to make sure you put it on the right way, because it's really important that it goes on the right way.
So Kate, bless her, she said, I'm sold. And I think this is about the whole thing, not just the mask. But she said, would we buy these from me? So I guess, yes, I would hold these in clinic and do it from there, wouldn't I? So that would be a really nice thing, to do somebody a treatment and then send them away with one of those to do maybe a week later or something.
Yeah, absolutely. Yeah, fantastic. Just your at-home maintenance. I think at this time post-pandemic, where people are probably not going to be coming into the clinic as much as they were before, the things that you can do at home to maintain a good, healthy skin.
I'm getting so many questions. What I've been prioritising is getting people's home care routines nailed down, and we're doing lots of that. I do have a home care product that we've been using as well, but to add something else to that would be fantastic, actually. Yeah. So the next batch of the wow mask has been repackaged and renamed, and to fit in more with the pink, because I'm obsessed with pink. So like all my other bits and pieces are pink. Yeah, I love your branding now. It looks lovely.
So the new mask is coming out. It's called The Mask by Wow Facial, and it's very, very pink. So that old silver packaging is old packaging now. So I've said goodbye to it. And my next batch is exactly the same mask. It's coming from the same laboratory, made by the same fantastic chemists who make this product for me. But it's just going to come out in new shiny pink packaging. So
I've got a question from Julie. Will I be putting price on page? Yeah, once I've so at the end of this, Claire, I'll stop the broadcast, but if you're okay to hang on for a few minutes, and we'll have a natter. Once I know how this is going to work, then of course I will add that onto the page and everything. I'm in the process of redoing my website as well, so that will get added onto that as we do it. Yeah. The other thing I've just written myself a note for is, so we said that there's very little downtime. So it's not like when I do my microneedling that I do at the moment. I say to people, 2 days time, you'll kind of look okay. And there is still obviously a place for that. But having my own experience, by the end of the day, no one else would have known that there was sort of much going on. So what do you recommend sort of for recovery, downtime and aftercare? What do you kind of recommend for that?
Yeah, so aftercare, always. I mean, if you've had a treatment like this, then you should never, ever leave a clinic anyway without any SPF. I think that's vitally important, just even if you're just going to get in the car, because we've disrupted that skin barrier function, which is there to protect us as well, also from sun damage. So always SPF. But there's not much rigorous aftercare at all. So no saunas, no steam rooms, no sunbeds. Definitely stay out of direct sunlight if you can. Drink plenty of water. That's always going to help. So we always say hydrate. So drink plenty of water. Eat plenty of fresh vegetables and greens that have got loads of lovely water in it. That's always going to be fantastic for your skin. And use a really good hydration product. So there's differences between hydration products and moisturizers. They do two slightly different things. So your hydration products really are your hyaluronic acid based creams and serums. And then your moisturizers are your more thick, richer serums. So, always try and use a hyaluronic acid based serum post this kind of procedure as well before you put on your moisturizer. You're going to get a much better result, and it's really going to start helping that skin heal in a much healthier way.
And when are you going to start seeing results from this?
Most people see results instantly, but actually when you have needled the skin, what happens is this healing cascade starts to kick in, and the way that the body heals, it takes for about 6 weeks for these small traumas that we've done into the skin to heal completely. So you will see an improvement in the skin for up to 6 weeks. And then after that time, depending on the ingredients that we've put in the device, some people's results can last for 3 months. We've seen people whose skin health has just changed for the better, because what we've done is we've stimulated this skin health journey. And actually, when people really care about their skin, if they come out and have a treatment like this, they do tend to go home with good home care, particularly if they've come to see somebody.
And to look after their skin a little bit more as well. If they're investing in something like this, people are then encouraged to carry on doing it, aren't they? So
yeah, absolutely.
So I've got another couple of questions. One of them, would it be suitable for me considering the meds I'm on? Obviously, from a confidentiality point of view, I'm not going to start talking about specific meds. So, Kirsten, I will get back to you after I've spoken to Claire about this. But are there any meds or any sort of things that are complete no, you wouldn't do this on them?
Yeah, I mean, there are some contraindications, which I will go through with you, Sally, but, you know, the main ones really in terms of medication are probably your blood thinners, and they're not even contraindicated. It is just that you need to be aware that you might bruise a little more, or you potentially could bleed. Usually with the 0.6 millimeter device of the Wear Fusion, so the most popular one, pinprick bleeding is very, very rare, but we do see it when people who are on blood thinning medication, that sometimes they can get a little pinprick bleed that might lead to little bruises, you know, especially in the more delicate skin under the eyes. But in terms of contraindication for medications, it's more contraindications for conditions. So, you know, dermatitis, eczema and psoriasis, we don't recommend that you would do this treatment over them. Anybody who's got active skin cancers or is just recovering from skin cancer, again, is a no-no. People who suffer with keloid scars or maybe post-inflammatory hyperpigmentation, it's not a contraindication, they're just cautions. And it always, you know, these things always are best to be done by a medical professional who can take a full medical history and do an assessment and then treat based on their findings, and a discussion as well, and a consent. So, you know, that will always be down to you, Sally, as to whether you can treat or not.
I think this might be really good for Kirsten then. So again, without giving too much away, we weren't able to do things like laser and IPL on her. I don't do that now, but when I did, I wasn't able to do those things with her. We have done some peels, but because pigmentation was a bit of an issue for Kirsten, this would be really, really good for her, I think, because it's actually quite gentle. It's not too aggressive. So this might be a really nice one to look at.
Yeah, absolutely.
Okay, and the Alison, there's a lot of science in it, you know, and that I love the science. You know, without that, you know, I wouldn't take something on unless I knew it was the best of its kind. So all of the treatments, products, and technology that I've got in my clinic is in the top sort of echelons of its type, and I would never get something just because it was a bit cheaper than the other one. And there's always sort of science behind why I choose a brand, a product, a bit of equipment, and all that kind of thing, because the science is so important. Because otherwise, people are not going to be happy with their results, or they're not going to get the results that they could. You know, just because we were skimping on cost for something, you know.
I mean, I'm a complete geek as well, so I, you know, studied human biology and things like that. I'm obsessed with how cells work, and I have to know the ins and outs of everything. What does this do to this? What does this do to this? So I'm actually working on a new skincare range at the moment, which is the whole ethos of the range is the science and aesthetic of skin, and it will be looking at how scientifically the products that we use change the aesthetic of the skin. And it's right up my street. I've loved to develop it, and it's all born out of my passion on you know, how the Wear Fusion works in the skin, the ingredients, the vitamins, the minerals, and the active ingredients that we use, and how they alter the aesthetic of the skin. So my next project is a skincare range that's going to be very, very science-based, looking at how the science changes the aesthetic of the skin. It's really important. We're not in the 80s anymore in terms of skin health and skincare. We've come such a long way, and I'm glad to be a skin health entrepreneur that is kind of pushing the science of skin health, because I
still have people who come in using apricot facial scrub.
That's what my mum used to use, the scent Isaac.
We all use the Isaac apricot facial scrub, but people still do. It's quite astounding. Yeah. But it is frustrating when you see, you know, outlandish claims made by products that you know aren't going to do those things. And I've seen a lot of it around lately. Products being sold by people who don't have any kind of medical or sort of trained background, selling products that you know don't have the technology behind them. They might be nice products and you might get a bit of hydration from them, things like that. But what you're not going to get is the support of somebody who understands the skin, you know. So I always would make sure I know as much as I can. And if I can't answer a question, I'll find out, you know, because it's so important.
Yeah. And I think, you know, the skincare and the modalities that we use in aesthetic medicine sit in the aesthetic medicine field for a reason. You know, there's a reason why they can't buy the skincare that they buy from you off the shelf in Boots. And a lot of it is to do with the very high-tech delivery mechanisms in skincare that make sure that skin penetrates and gets to the cells that needs that active ingredients.
Yeah.
And those kind of ingredients are just not available in skincare that you can buy off the shelf in Boots. I always say skincare that you buy from the high street is the most expensive skincare. So you might pay 30, 40, 50 pounds more even to come and buy something from you. But if it works, it's not a waste of money.
Whereas, yeah, when people say that they use cosmetic-based products, I'd rather they bought the £7 award-winning Aldi moisturiser than the 140 quid creme de la mer or whatever it is, that is probably fundamentally the same product and isn't going to give you any more benefit. Buy the cheapest one to tide you over and then come and get some decent stuff from me when you want some results.
Yeah, absolutely. So, your £7 Aldi moisturiser is still more expensive than your £70 serum that's going to do something.
Absolutely, yeah.
It's a waste of money in terms of transforming your skin health. Feels nice, looks nice. We all love our things where, we're women, we like how it feels, we like how it makes our skin feel, we like how it smells, we like how it looks, how it's all packaged and everything. And that is, a lot of the how the cosmetic industry works. But actually, if the products don't work, they're still fundamentally a waste of money. That's my opinion.
No, I completely agree. I couldn't agree more. So, okay. So unless anybody else has got any questions, because obviously this didn't go into the platform I was hoping to. I'm hoping I can lift this out and drop it into the group, and I'll probably drop it across on some other places as well so people can see this. And if anybody has any questions following this, please do drop them underneath and we will address them. And Kirsten, I'll take yours personally and I will come back to you, Claire, and ask the information on that. So thank you so much, Claire. It's been really, really interesting. And I'm still learning here as well, so I can't wait to get started on this.
Yeah, thank you for having me. I really appreciate it. And thanks for all your questions, guys. So you're getting a lot of wow-looking clients after this, Sally.
I can't wait to
get to work.
I just want to start getting my hands on people again. It's so frustrating. So for the purposes of the live broadcast, we're going to switch off now. So thank you, guys. And any questions, I'll come back to you later. Claire, I'll talk to you afterwards briefly, if I may. See you all later. Have a lovely day.
Thanks for tuning in.
Now it wasn't here. So enjoy the sun, wear your sunscreen, and I'll see you all later.
Bye.